Well, good morning. Let's go ahead and get started. Thank you for coming. Those of you on the phone, if you will remember to mute your lines. And also, we are broadcasting over the internet, so if you do weigh in on the phone, will you ensure that you turn down the speakers on your internet feed as well so that we eliminate that feedback. Welcome, everybody. So this is our second stakeholder meeting to discuss LCB file number R004-14, the proposed regulations based on work that we've been doing since last October. Just remind you, if you have cell phones in the audience, if you want to put those on vibrate as well. And we did email out yesterday the discussion points for labs. I'm hoping everybody has that already. And I will go ahead and get started. Do we have anybody that wants to open with general public comment?
Hi, Greg Sibelian with Silver Liberty Alternative Medicine. I had a question pertaining to building requirements. I know it's not going to be addressed in what you're talking about today, but I think I might have missed it or misunderstood a regulation. It's about if our LLC can have a marijuana grow and a dispensary under the same roof. And it didn't really, the NRS didn't really explain that too deeply. So I was just wondering if that's a question I could ask right now. Like in the back have the grow and in the front the dispensary. Can they be under the same roof?
Sure. Good morning, Chad Westham, for the record. You know, we did discuss that previously. There's some guidance on our website about separation for buildings and what a separate building means. And also, you know, as we discussed last session, you can have both those operations, but they're both separate applications.
Correct, separate applications.
Okay. And then there's, you know, anyway, so there's the guidance was about separate buildings is that if you're going to have that sort of arrangement, you're just going to need to be separation between the two operations.
Correct, with the proper security and
yeah.
walls, I guess.
Does that answer your question?
It does, yeah.
Okay.
Because we are looking at buildings this week, and it also said a separate building, but it doesn't mean a freestanding building, does that?
It does not have to be freestanding per se.
Okay.
It's subject to local requirements.
Correct. Okay, thank you. Appreciate that.
Yeah.
Anybody else? General public comment? Okay, well, let's go ahead and get started. Chad?
All right, good morning. So, you know, situated here. So I'll give overview of some of the sections pretty rapidly, and then, you know, I'll turn it over to questions in Las Vegas, Carson City, and those on the phone. So if you want to turn in your regulations to section 63. Okay, so there's...
No, that's like they cut it off on their side. The guy was speaking, and all of a sudden it's completely off.
It's on, she did say it was on the internet.
Okay, so if you could please mute your phone till we get to the question and answer portion. We're just going to do the overview here. Okay, so section 63, you'll find in these regulations that there's each section starts out, you want to pay close attention to where it speaks to medical marijuana establishments, and some regulations you'll find speak to edible marijuana products, others speak to infused, others speak to cultivation, others speak to dispensaries and laboratories too. But you know, sometimes if you're reading and you feel like, well, I already read this section, it's because you're reading a section that is for a different type of establishment, and that, there's additional requirements, than the previous establishment, if that makes sense.
Apply to the taxes.
All right, so, all right, so you want to mute your phones, as we said. We're still hearing some feedback, and we want to make sure that
Insurance premium tax, and then ask for an account.
everyone in the meetings can hear well. Okay, so section 63, and like I said, I'm going to move pretty quick, is about edible marijuana products, and it starts out by just reiterating that you're going to need authorization from the division to prepare, sell, or dispense edible marijuana products. Moving on down to section 2. It is just reiterating that the establishment is responsible for the content and quality of edible marijuana products that are sold. Section 3 speaks to that the edible marijuana products are not subject to the provisions of Chapter 446 of Nevada Revised Statutes or Chapter 446 of Nevada Administrative Code. Those are traditional food requirements in the state of Nevada for commercial and retail food production. So the intent of the law and the way the law was written, the definitions given, and the way we wrote the regs is that this is not food, this is medicine. So you'll find that our requirements here, the standards are higher than what's required for food. You're going to have additional training than if you were just running a sandwich shop. You're going to need to
Real bad connection. He keeps going in and out of the speaker. Yeah. You finding this, Christy?
Good morning. Whoever is talking out on the line, talking to Christy, your line is open so we can still hear you. There could potentially be problems on the line when callers are coming in, that it's cutting out from what we're talking with here. I apologize for that. But, would ask you maybe to listen on the internet if that's the best way, mute your phone line, and then when you break in with questions, to mute your internet speakers or whatever that's projecting from so that we can reduce the feedback.
Okay. All right. Okay. So as I was saying, is these requirements are for medicine, medical marijuana medicine, and that's the way the statutes laid it out. And we worked on this early on, and this was the interpretation given to us by the Attorney General's office. And so, you will, if you are one of the businesses that's producing edible marijuana products or infused products, those inspections will be done by the state Division of Public and Behavioral Health. And then Section 64 is just clarification that if there does happen to be any environmental impact from the operations, that the establishment would be responsible for that cleanup. Section 65 is just a reminder. Some of these things are standard, but just a reminder that there shouldn't be any additives to any of the products, such as food colorings or fragrances or fillers. Section 66 speaks to medical marijuana dispensaries, the hours of the operation, that they need to be making the sales and distribution of the product during hours of operation, not after, of course. And then there's also the reference to the local government requirements for hours, which would need to be complied with. You'll want to post those hours conspicuously from subsection 2. Section 67 speaks about the patient records that would be necessary at a dispensary. for, those that come into the facility and make purchases. There'll be, standard requirements such as dating, signing by the agent who's recording the entry, the number of the establishment registration, I'm sorry. Well, okay, the number of, the registration number of the facility, as well as the agent that's involved. Talks about electronic signatures. And then keeping of records. The information here in this requirement is that you need to keep records of all your transactions for 5 years minimum. And then as far as patient records, if the establishment is maintaining those electronically, there does need to be safeguards to prevent unauthorized access. And then you can read these requirements yourself, and I'll not read this regulation to you, but feel free to come up with your questions. That's why we're here today. Okay, and then just to highlight towards the end of section 67, there does need to be a record, and would be under C, 3C. For each time a patient comes in, requests a product but does not obtain it, there does need to be a record of that, and it specifies exactly what needs to be required or what needs to be recorded at that time. And then section 68 speaks to dispensaries who recognize non-resident cards or reciprocity, as we were talking about last stakeholder session. It does say that you'll need to enter information about those non-resident cards into your system. Okay, so section 69 speaks to that you need to keep the products and medical marijuana products, the edible products, the infused products behind a counter or other barrier to ensure customers do not have access. And then upon request of a customer, the dispensary does need to disclose the name of the independent testing laboratory who's doing the quality assurance analysis. Section 70 speaks to claims that you're going to have on your products. And in short, as you can read, you don't want to put yourself in the situation of claiming your product is organic unless you have met the standards set out by USDA and your products have been certified as meeting those. Otherwise, it would not be appropriate to claim organic status for your products. So section 71, when cultivators are providing product to dispensaries, they do need to disclose in writing soil amendments that were used, fertilizers, other crop production information, the name of the independent testing laboratory which performed the QA tests. Subsection 2 of section 71 speaks to that the cultivation facility may provide to the dispensary free samples and it talks about a jar, but these are to be able to smell the product and evaluate it before purchase. But it does say, that's its purpose of just being for samples, not free distribution. Section 72 gives an outline of authorized personnel in the facilities. Subsection 3 is one that's been talked about before. We had a question this morning about the location of the facility, and that you cannot you should not be able to observe the marijuana growing from outside of the facility, and that there's not an odor that is detectable from outside the facility. Section 73 is about the packaging of the products. This specifies child-resistant packaging, specifies that it should be in a thick material plastic. It actually specifies 4 millimeters or more, and the specific kinds of enclosures that need to be used to prevent access by children. It specifies what kind of cap is necessary for marijuana-infused products. And then just general guidelines for production of ensuring prevention of contamination from toxic or other inappropriate substances. Section 74 is talking about at dispensaries, we're getting into labeling. And as I said, like, you'll want to, as you're reading through these, studying them, preparing if appropriate, you want to like look at the terms used of where the requirements apply for labeling, because it looks redundant, but it's not. There's specific requirements and additional requirements depending on which facility type you're talking about. Okay, so section 74 then is talking about the labeling materials that is used. They need to be kept secure, and you need to have written procedures for how those will be managed. Section 75 is talking about cultivation facility, actually most of the facilities. It's talking about the product labels and collection of representative samples of the products to ensure that they have correct labeling. Section 76 is just specifying that in your packaging you want to make sure that none of your products are produced with more than 2.5 ounces of marijuana. And also specifies the labeling size. Section 77 provides requirements, like specific requirements of what needs to be on the label, such as lot number, date of harvest, date of testing, the date it was packaged, the analysis, such as potency, the laboratory requirements, and if there's the product is perishable, an expiration date. And that's if the product is perishable. That's not requiring an expiration date on everything. Talked about that at the public workshops. Section 78 is information that must be, and you'll see like just prior to 78 an example that might be useful in a label. Section 78 talks about the dispensaries, the labeling, and the information that must be affixed to each container. And then it goes into some warnings that are necessary to be included, such as the product may have intoxicating effects and maybe habit forming, and the product may be unlawful outside of the state of Nevada. And then there's additional warnings after the example of a label, such as the product should not be used by women who are pregnant or breastfeeding. There may be health risks associated, and the product's for use by the person named on the label of the dispensed product. Keep out of reach of children, and so on. And then Section 79 provides some additional requirements for products that are marijuana products that are edible or infused. Such as, if the product is perishable, a suggested use-by date, a list of all ingredients used in that product, as well as those that are, considered major food allergens as described in federal requirements. And then some accompanying material starting in subsection 3 of section 79. and that, and these are some of the warnings we went over before, specifically those that you're trying to keep the products out of the hands of children. It specifies that the text needs to be in a reasonable size to read, such as 12-point font. That's from subsection 4. And I'm going to take a break there because the next couple sections get into the specific requirements for medical marijuana, edible products, and infused, and that's a slight transition. So why don't we work on or take some questions first from Las Vegas? You want to come up to the front and hit the microphone button.
My name is Michael Betts with Third Day Creation here in Las Vegas. I just wanted to touch on the organic standards. Is there currently a process in which we're going to be able to actually certify that? Or is that just ensuring that we follow the regulations outlined by the federal government at this point?
Welcome, Michael. We have not developed standards such as that where we have as many staff as we have available working as fast as we can on the regulations on the program. That's not something we're going to be able to develop. It may not be appropriate for something like that to be developed at our level, but the regs do say, if you're at the forefront of this industry and you're able to arrange to have your product certified as being organic, that would be something you could do. It just says that you're going to have to meet the USDA standards and you're going to have your product certified. And there are a lot of worldwide and national organizations that certify to organic standards. So that would be between you and them.
Okay, just one follow-up question with that
Sure.
then. In the merit process, though, the state is still allotting points for the application to certified organic materials, correct?
Still allotting points. It'll be considered. We'll be looking at that, but no. One moment. So anyway, on the organic aspect, it'll be something we'll look at with the applications. It's, we're not to the point to where we could tell you what the value of that is as far as the application. That's still in development. That's one of the things we're working on.
Thank you.
Morning, Karen Becker.
Morning.
I have a couple of points for clarification and questions. 63(1)A, I just want to make sure the intent here is to obtain written authorization from the division after licensing. Is that correct? It's in addition to and after you're licensed?
There's actually quite a bit in this section. It's speaking to and reiterating that if you are going to be producing these products, then you do need to be, authorized from the division. The first step, of course, would be to apply and be granted a certification.
Yep, my question is in 63(1)A, the way it's worded, it reads as though you have to obtain written authorization from the division, which sounds like, as in some of the other places throughout the regulations, that you need written authorization in addition to your license.
I agree, that is the way it reads.
Okay. 63.2, the medical marijuana establishment is responsible for the content and quality of the product sold. In my next comment, this is going to kind of come up, but if you are a dispensary that is purchasing your edible or infused products from a production facility, this seems to shift the burden of the product liability back to the dispensary. That the intent there?
I mean, that it does, is what it suggests, and was some of, I mean, was part of the intent of the language there. You know, it would be on a case-by-case basis and would involve, you know, legal perspectives if something were actually occurred where this needed to be addressed.
Okay, thank you. Section 76(1), and again, it reads here, any medical marijuana establishment that packages marijuana, and here you want the packages to be no more than 2.5 ounces. When you are packaging at the cultivation, if you want to sell from your cultivation to other dispensaries or to your own dispensary, I think that's a little burdensome to require everything to be packaged in 2.5 ounces here. Perhaps there could be a carve out for cultivation to dispensary.
Right. Okay, so there's section 76. It's speaking to, you know, that you have a medical marijuana product that's getting packaged. If you are a cultivator and you're providing it, you know, you're selling it to a dispensary, we wouldn't consider that packaged. That would be more in a bulk type container. And anyway, this is speaking to packaging at what you might consider, for example, the retail area, like a retail product. So I think that should address your concern.
Okay, and the last one is section 79(3). This is regarding the accompanying material. So here the burden is on the dispensary to provide the accompanying material for the products which are the infused products that are sold through the dispensary. And again, I was wondering if we could add or change this so that maybe the production facility has to provide this accompanying material. And then the production facility could provide it to the dispensaries or to the dispensaries that they sell through.
Oh, okay.
Karen, this is Marla. I think a dispensary is within its right to ask that a production facility provide that information that it then provides to the patient. So that option is available for the dispensary to demand that from whomever they are purchasing their product. We don't want to set up a separate burden. We're really laying their responsibility on the dispensaries to understand what it is they're selling.
So I guess it's the dispensary option then to decide whether to retest before selling at retail? Or can we rely on the information that we get from the production?
Well, Karen, so these regulations are, you know, a lot of work has been put into them, and they're lengthy as they are now. We're not looking to have additional requirements. If the dispensary and the cultivation facility or production facility have an arrangement for the production facility to produce this material, then that's between the two businesses. But what Marla was indicating was ultimately, like, for example, if the production facility and the dispensary in their contract, it doesn't provide for this material, the division and our staff, we would still expect to see it. And so the dispensary would have to produce it if that was the case. But that, like I just said, that's business and contracts and arrangements between two businesses that we don't want to provide specific requirements on. We just want to ensure it's there by whatever means necessary. Does that help?
Thank you.
Okay.
Thank you. Yep.
Sure. Okay, so why don't we take questions from the phone on these sections we've gone over? You could just say your name, please, prior to starting.
This is Adam Mentz from Steeple, Hayland.
Good morning.
Hi. So there's some problematic language in Section 76 in relation to marijuana or marijuana products must be individually packaged, labeled, and sealed. But the problematic part is no single unit contains more than 2.5 ounce supply of marijuana. That's appropriate for dried cannabis, but when we're referring to marijuana products, things like edibles are going to want to be expressed in milligrams of THC, and concentrates or processed cannabis. 2.5 ounces is quite a significant amount, and I really think we need to think strongly about adding or something that's applicable to edibles and concentrates here, because we have thrown the marijuana products under the 2.5 ounce supply, which won't allow for actually any limit, at least on as far as edibles are concerned, due to the variation in THC and plant matter.
Adam, this is Marla. It says packaged such that no single unit contains more than a 2.5 ounce supply. So it can contain less.
No, but my question is marijuana products. So what are packages of marijuana or marijuana products? I'm assuming marijuana products would include edibles?
Yes, but it's talking about the unit size. So are you saying that an edible unit size would exceed 2.5 ounces?
Well, my point being is 2.5 ounces is arbitrary, because you could have 2.5 ounces of 10% THC, 2.5 ounces of 15% THC. So you're really not putting a limit as to the strength of the edible. Edibles need to be expressed in milligrams of THC, because you could have 2.5 ounces of very weak cannabis or extremely strong. So you're really not regulating it by using the dried weight of the cannabis in reference to an edible.
I mean, I think I understand that concern, but this is a top end limit. And I think we're willing to consider if you have additional language that might talk to a maximum amount for milligrams for edibles. I think we've discussed this previously. I don't think we've gotten anything that specific, but we're still willing to entertain it if it's a technical issue that we need to resolve.
Yes, and then additionally, I would just like to add that 2.5 ounces of, if we're also considering extracts to be marijuana products, 2.5 ounces is a very significant amount of concentrated marijuana. I'd just like to put that out there.
So again, if you're looking for a limit on the top end, because that's what this is speaking to, then to identify what that top end limit would be for those products, then we can consider that.
Okay, thank you, Marla.
Any other questions from the phone?
Yeah, hi, this is Jim Barlow.
Hi, Jim.
Hi. I just want a clarification on Section 73. The child-proof packaging requirements, is that for wholesale distribution as well as the retail end user, or are wholesale not required to package in child-proof packaging?
This section 73 is talking about marijuana products or, products containing marijuana to be packaged in the child resistance packaging. It's a concept of packaging. It's, we don't consider cultivation and products or marijuana going from the cultivation to the dispensary as being packaged. That's more wholesale.
So it's more for the retail, the end user is what we're talking about.
Correct.
Cultivation, we can throw it in a brick with a label, whatnot, appropriately, and that's the way to go.
Yes.
Okay, thank you.
Sure. Any other questions from the phone? Okay, Carson City questions?
Good morning. Peter Kruger, for the record, representing the Nevada Medical Marijuana Association.
Good morning.
Good morning. A couple of questions. In looking at both the statute, the NRS, and the NAC, proposed NACs, I see no reference or even prohibition about outdoor grow. Is the intent of the division to deny or prohibit outdoor growth, outdoor grow facilities? Because nobody addresses that here.
Marla can provide more detail if desired, but the way, when we were developing the regulations and with the guidance we received and the Attorney General's office was that these facilities should not be outdoor. And, there's the possibility for a greenhouse type arrangement as long as it's, like the regs say, the products are not visible from the outside, which we agree might be a challenge, but some say it is feasible. Our understanding is, full outdoor grow visible by the public and everyone is not appropriate.
A follow-up to that, if I may, then you're saying nowhere is outdoor grow prohibited. However, your example of being screened or something, I mean, it is conceivable that you could put a fence around an outdoor grow, make it opaque, and therefore make some of these standards about visibility disappear.
Correct. I mean, it's been said that, we've heard ideas where, you can make use of some sort of greenhouse design, but still meet these requirements.
But you're talking greenhouse, and I want to get to that in a minute, but I'm talking about strictly cultivation outdoors on a plot of land surrounded by a fence that is opaque.
Right.
Is that prohibited?
It's not visible from the air either. So if you can make it completely opaque from all four sides, then it may be allowable under the state regulations. And then there are still the local government regulations that may further clarify that.
Understand.
He's asking about full outdoor grow.
Because that brings up my question about greenhouses and aircraft, and so the division chief just said then, if I understand correctly, that whether it's outdoor or a greenhouse, it must be screened or in some way opaque from the atmosphere, from flying over the facility or in any way. I mean, I understand, obviously, the ground takes care of itself. The four walls take care of themselves. I mean, it's easy, but the roof has to be opaque. Is that true?
That's what we're discussing. That's what these regulations outline.
Okay, thank you. One other question, in reading section 72, 3A and B, let me address B first. Emit and odor, I find that to be a very subjective standard. With noise, we have ways in decibels. I'm not a scientist, so I don't know that we have ways to measure odors. Maybe we do. But I find this very, very troublesome that somebody who might be opposed to a grow operation in particular could say that they could smell the odor, and there's no way to prove that he or she can really smell it. I may not be able to smell it, but you could. So I find that very subjective. I don't have an answer for you. I mean, I know there's filters and positive pressure and all that, but I think that's a pretty subjective term in these draft regulations. And A, of course, I read, going back to 72, 3A or 3, the fact that each cultivation facility shall ensure that any marijuana grown inside a building of the facility, then A and B apply. Well, that got to my question about outdoor grow, because if you can, it's outdoor grow's not in a building, so therefore A and B wouldn't apply the way I read this.
Peter, thank you for your input on that section 72, 3. And we did consider that as part of the public workshop, and you know, thank you for your input. If there's something that comes across that solves it in the very short term, you know, we can consider that. But otherwise, you know, that's the standard that we put in place. As far as the outdoor grow facility, I'm a bit on the spot here to, you know, look up to provide you an NRS. But the guidance we received was that these full outdoor grow, like some other agricultural crop, corn, wheat, what have you, alfalfa, the medical marijuana cannot be grown that way. And we'll have to get back to you on the rationale, unless you have a reference, Marla.
Well, Peter, I think you're correct, and I think we're going to clarify that section in a technical amendment to specify that it's any marijuana grown and eliminate that inside a building portion.
Thank you very much for your time.
Thank you.
Good morning. This is John Sutton representing HW Wellness.
Good morning.
I think the gentleman's name was Peter, and I was going to provide some context around Section 72 regarding the detectable odor issue that he expressed. And one thing that I thought is, of course, it was kind of nebulous the way it was written, detectable odor. And the reason it would be for me specifically is one of our partners works with police dogs. And detectable odor is defined by canine, which the code does not preclude as a definition, is about 100,000 times stronger than humans are capable of detecting. I would ask that the regulation be rewritten to reflect that this is a human standard and not some other standard. And the reason being is, right now people that are looking at establishing cultivation MMEs, of course, and looking at the proper building requirements, are in the process of determining odor mitigation strategies or protocols. And if we have to adhere to a canine criteria there, it markedly not only increases costs, but honestly, at some junctures, will preclude certain buildings from even being feasible. So I would ask, in support of what Peter stated, that we consider at least defining that as a human standard, what is typically definable or detectable by a human, acknowledging that with my wife and I, that's vastly different as well, but much more favorable in terms of a definition.
Thank you for your input, and we appreciate the suggestion.
Thanks. One other item that came up in the meeting, I think it was late last week, that I just want to hit on if it's appropriate. A woman came to the table and asked about the allocation of patients to dispensaries, and I understood that wasn't something that you're going to be doing formulaically. But the follow-on there was onerous to me, which stated that an individual can determine that they have a preference for a specific dispensary. And in my reading of the NRS and the code, I assumed that there would be some limiting factor around during that preferential designation, a party had to specifically buy from that dispensary. Now that made sense to me because I want to be able to adhere to the 2.5 ounce limit that the state has established every 2 weeks for a specific patient. However, and we're in Nevada, so I'll use the phrase gaming the system. You could find a patient that was willing to go to multiple dispensaries. And as long as the electronic verification system the state has alluded to has not been established where multiple entities can access real-time data, you could literally envision a scenario in which I leave dispensary A, I drive to dispensary B, I drive to dispensary C. If the dispensaries are going to be culpable legally for someone exceeding the 2.5 ounce limit, how does that scenario actually work?
So that's a question, that we'll be answering later in the future. I mean, we're developing some of these systems right now, and but like all I can tell you is conceptually, if we do our part and the dispensary does their part, and you work with the tools that we've partnered on, such as the verification system, then something like that would be challenging, if not impossible, to occur. I mean, there's always going to be people who try to find the loopholes or circumvent the law, and this industry and this new program will be no exception. But I can't answer a question like that. Like how, I mean, we'll be doing our best to come up with a system that works for the establishments and the division to prevent things like what you just described, John.
Thank you.
All right. All right, I don't see anyone else from Carson City coming up, so we're going to move on with the remainder of
Could
these.
I have a phone follow-up, please?
Sure. If you could please give...
I'm sorry to interrupt. This is Jeff Harris, and thank you very much.
Thank you.
I wanted to follow up real quickly on Peter Kruger's points and ask for some additional clarification regarding sight lines of potential greenhouse or light deprivation type of a grow. In that, if I presented a hypothetical whereby there was a cultivation facility at 3,500 feet above ground level, an hour and a half outside of Las Vegas in a bordering county, and this was private property that could only be viewed by the owners. How would that be interpreted by the regulations as they exist now, whereby you'd have private property and somebody that would either be given a leasehold or what have you, but other people would not be able to view the grow at all?
They have a thing in here about if the cultivation facility has to be in a building and the odor can't be detectable.
All right, so there's some feedback on the line, but to answer your question, I guess I don't prefer to engage in hypotheticals right now, but wherever your facility is located, in a private property or otherwise, this regulation would apply to where it's being grown. It cannot be observed from outside the building, or our intent, which is outside the establishment. So no matter where it is, if it's in the state of Nevada, it's the intent of this regulation and the guidance we've received is that it should not be visible from the side or the top. And, so work needs to be done to where that is possible.
So if I may, one of the solutions was that there could possibly be a fence around the greenhouses. Has there been any thought, or is it going to be left open as to how tall a fence might be required, obviously by local ordinances that may be somewhere in the local ordinance, but there is nothing as it exists now in the division's regulations?
We do not have specifications required for a fence at this time, but as these regulations go through and they're adopted, and with the guidance we've received and from the Attorney General's office, the intent is, and the standard will be that the product, being grown, cannot be observed from outside, and again from the sides or the top. Or the bottom. I mean, if you're doing something up a few floors or something, it's not, the intent is that the product, that someone from the outside would not know by their sight anyway, that really, or other means, that what your business is.
Okay.
Jeff, I'm not saying it's easy, but that is a requirement, and that's why it's written the way it is.
Right. I guess I'm just trying to get some definition on it, as opposed to if there was an 8-foot fence, would it be looked at as if somebody could grab the fence and look over the fence, could they still see it? So it's a little bit open to interpretation there.
That true, but when we review the applications, if the staff are reviewing it, if they see clear or very obvious ways where this product can be viewed from outside, that's not going to be something that you probably want to submit.
Okay. All right. Thank you.
Thank you. Okay, so it looks like we have a question in Las Vegas. Go ahead, please. Name and question.
Good morning. This is Martina Giacarino from Black and Labello. Going back to 453A 72, again about the detectable odor, we've done a lot of research and investigation on this issue without even factoring in the drug dog making the standard even harder than human, and have not communicated with anyone who's operating a grow facility of any size who could meet this standard. And I understand that we are, getting close to having things finalized, but we would suggest that if in fact there is a solution to this issue, that perhaps that solution could become part of the statute instead of what we have now, which is a little bit vague. And again, we have tried to find an appropriate way to meet this standard, and it seems that it wouldn't be possible. So we would request that clarification at some point. Do you have any information that there are facilities working that could meet this standard?
We've done a lot of research across the country, and within states that have programs that are in the ballpark of similar to what we're developing now. And our understanding is that some of these establishments in these other states, are able to meet standards such as this.
Okay, well, we'll definitely look into this further, because of course we want to submit a program that meets, if does not exceed, all of the guidelines and requirements. So we appreciate that.
Okay.
Another section I would like to touch on just briefly, 453A 2.10. This is addressing patient dispensaries. And in reading
I'm sorry,
the
what's
statute,
is that a section of the regs?
I'm sorry. Yeah, section 2102F, having to do with the designation of a dispensary.
Okay, I think that might be in the statutes. Because we don't have a section 210 in these regs.
Well, maybe you can answer, perhaps there's a really obvious answer to this question that I've missed. It seems that in some of the areas of the statute, it indicates that the patient has discretion as to whether or not they identify their primary dispensary. But it also seems that if they choose to designate a primary dispensary, then they have to stay with that dispensary. Is that not the case? Are they mandated to select one dispensary?
This is Marla. In our reading of the statute that you're referencing, I don't see that it compels the patient to only purchase from the dispensary that they've selected.
Okay, great. That answers my question. Thank you very much for your time. Thank you.
All right, thank you. So if you want to turn back to your regulations, we're going to continue with the brief overview prior to questions. Okay, and as I mentioned before, starting in section 80, where this section does start into the specific requirements for edible marijuana products or infused products. And again, as I said before, you know, if that's the business that you choose to be in and you're going to produce edible marijuana products, you know, the standard is set high because the statutes intended for this to be medicine, and the medicine is potentially given to people with compromised immune systems. So we want to keep the products as safe as possible. So starting in section 80, it describes potentially hazardous marijuana products and ingredients. And so depending on what products you are producing, that should give you guidance on if it's going to be potentially hazardous. And then the translation there would be, do you have to control the temperature at which it's stored? Are you, you know, how you handle it as far as on your counters or your work tables and so on. Section 81. This is kind of introductory requirements whereby, you know, if you are going to be producing edible marijuana products or infused products, the person responsible for the facility shall know about disease transmission and prevention, the requirements of the statutes and the requirements of these regulations. And that whole section outlines what the knowledge that's necessary. Of course, just a reminder to mute your phone at this point until we get to the question time. We're hearing some shuffling of items, if that applies. So anyway, that section goes on to talk about knowledge of the relationship between prevention of disease and personal hygiene of medical marijuana establishment agents. Okay, we're hearing a lot of feedback on the phone. So if you could please mute, that'd be great. Okay. And hazards involved with the consumption of raw or undercooked products. And these regulations are written in a broad enough sense to where, you know, there's a whole lot of baked items that are currently in other states that include medical marijuana and they're baked. But, you know, we've heard that there's other things on the horizon for new products with marijuana. So the regulations were written to where if somebody decides to get into that arena, that there would be appropriate requirements to where they could keep that product safe and they would have the proper knowledge and training and equipment and facilities to produce that product safely. Section 83 specifies how those who are producing products need to wash their hands. Section 84 outlines the events or intervals at which they need to wash their hands or when. Section 85 outlines that when you have a finished product, a finished produced medical marijuana product, there should not be any bare hand contact with that product. At the point where it's going to be packaged and, one of the next places it touches is a patient's hand or mouth, there shouldn't be any agents having their bare hands on that product. Section 86, and it talks about options of how to meet that requirement. 86, if you have products that are in production, not finished, you should strive to minimize bare hand contact with those products in those stages. Actually, that was all Section 85. Section 86 talks about that you need to have only commercial ingredients. No homemade ingredients, no products or ingredients that came out of somebody's private home, no secret recipes that you produced in your garage can go into these products. All right, so Section 87 talks about the safe handling for the medical marijuana edible products or infused products. Talks about using separate equipment for each type of raw ingredient, preventing cross-contamination from raw items onto prepared items to where someone could down the road get sick from it. Section 88 is additional requirements that outline, for example, if you're cooking or baking the products, if it has raw eggs, you're going to want to cook them to 145 degrees internally for 15 seconds. If you're using meats or other products, there's language requiring minimum cook temperatures. It also indicates, if you've got keeping products warm, for example, for a period of time during production, you have to keep them at 135 degrees or warmer, or cold products need to be at 41 degrees or less. And then you're moving into Section 89. It talks about how the product should be labeled and dated. Because if for example, if you've got ingredients that can grow pathogens or potentially hazardous, as was defined previously, you're only going to be able to keep those on hand in your facility for 7 days. After that, they will need to be, discarded or have been used up. And the dating here is standard, in the industries that are relevant to date them so you don't have products that could grow bacteria such as listeria. Section 90 gives some requirements for equipment, not equipment that is durable, doesn't produce odors or any leaching into the products, finished with smooth, cleanable surfaces. Related to this, if you are producing edible marijuana products and, if you intend to acquire like commercial food equipment or food processing equipment, those that are certified to NSF sanitation standards, those would be appropriate for this business as well. Section 93 starts to talk about cleaning, washing, rinsing, and sanitizing of products, not products, but like equipment and surfaces that are going to be in touch or in contact with the products. You are going to have warewashing sinks in these facilities. If you want to have a dishwasher that can properly clean and sanitize, that's great, but that'll be optional. You're going to have some sinks as least the baseline standard. All right, section 92 touches onto ventilation necessary for these establishments. And then section 93 starts into, as you're producing these products, there's a variety of ways to wash, rinse, and sanitize the equipment and surfaces in touch with the products, such as chlorine products, quaternary ammonia, iodine, temperature, and those requirements are given there. Section 94 talks about the surfaces of the equipment in more detail. And basically it talks about that when you need to clean those surfaces before working with different types of products, when you're changing from working with raw products or cooked products. You know, if you're using raw fruits and vegetables in any of your products, those bring some risks as well, so you're gonna have to clean and sanitize at those points. Some of that's not unlike commercial and retail food establishments. Section 96 outlines for you the cleaning and sanitizing of different surfaces. And also section 97 outlines that as well. Starting into section 98, talks about the lighting requirements in these facilities. You know, you, in particular, in areas where you're actually producing and there's raw product, you're gonna need 50-foot candles of light. And that is, the purpose of that is so that you can see to clean, see to produce, see what you're doing clearly. You know, also cuts down on safety issues with knives and employee injuries. Section 99 speaks to ventilation, a little bit different requirement than the previous section. Okay, so then as you get into section 100, 101, there's specific requirements that are more pertinent to infused products, such as, you know, filters and their fiber content. And then it talks in like section 101 there, talks about solvents that to be used in infused products, and talks about the use of CO2 gas extraction for infused products and the purity that's necessary and the safety requirements that are necessary so that there's no accidents. Section 102 kind of transitions into a different section. These are good manufacturing practices that apply for production and cultivation. These guidelines, their source, other than, you know, other states where we've mentioned before that we use some language that's appropriate from other states, these also come from requirements by the US FDA for producing medicine. So they're not as exhaustive as some of those requirements, but that is some of their source. Like starting in section 103, for these good manufacturing practices, in section 103 there needs to be a quality control unit that has the responsibility and authority to reject components, product containers, closures, packaging material, and products, has the authority to review all that. So we're just outlining the guidelines. We're not going to tell you exactly how to make that happen. But they do have a defined role in these regulations, and that is consistent with, you know, businesses that produce medicine for patients also have such a requirement. Section 104 outlines clothing that's appropriate for the different duties in the establishments. Section 105 has some requirements for the buildings that are in your establishments, like whether they be several or one. But the way they need to be maintained and kept clean and organized. Also on the moving into subsection 2, that the flow of the components, product containers, closures, and labels needs to be clear, and you need to have policies and procedures about how that's going to flow through, how the product's going to flow through your establishment. You're going to need, as indicated, moving on in that section, you'll need procedures for receipting, identifying, storing different components, product containers, labels, appropriate sampling, testing, and examination by the quality control unit, holding rejected components, containers, or labels, for example, and so on. Quarantine storage, if that's necessary, it's outlined in this section. And then section 106 talks about, this is a general requirement for general lighting requirements in all areas of the laboratory, cultivation, or dispensaries, where there's not edible marijuana products or infused products being made. This would still be just some general lighting requirements. Section 108, proper drainage is required in the facilities to where you don't have some sort of sewer problem or other really inappropriate situation or back siphonage. Section 109 outlines procedures that are necessary for sanitation and cleaning and also of equipment and materials in the buildings, the use of appropriate insecticides, the cleaning and sanitizing chemicals in the establishment. Section 110 specifies in the cultivation facility that the buildings used manufacture, process, or package the marijuana are in a state of good repair, and they're maintained in that status. Okay, so and then we got general equipment requirements, starting in section 111. It's talking about in the cultivation facilities and in other production, just general requirements as far as their procedures and cleaning and maintenance of them, and schedules as well, who's responsible for them. Section 112. We've got for production and procedures, refers to the quality control unit having a role to review all of those. And section 114 is giving some specificity as far as management of the labels, because it's been identified that the labels need to be secure and the packaging materials, and that they are not being used inappropriately, or like if you have to replace, for example, you have to update your label and provide new information on there that you're only using the new authorized label. The old one has been, discarded or recycled, and because it's very important what you're putting on these products, that it's accurate and it includes the required information. And like it, wraps up section 104 by the policies and procedures required to destroy obsolete and outdated labels, labeling, and other packaging materials. And section 115 does talk about, in the event of a negative situation where you have, for example, fire or flood, damaged products, what might be options for you for salvaging some of those products, and the laboratory analysis that would be necessary, and the authorization from the division to continue to use those products. All right, so that kind of concludes those sections. Let's see, I think we'll just follow the same path. So Las Vegas, if you have questions, you want to come to the table on those sections, be happy to provide some additional insight. All right, well, so on the phone, if you have questions on those sections, please give your name and let us know what your question is. Carson City, questions on those sections?
I do have one phone question. This is Jeff Harrison.
Hi, Jeff.
Thank you very much. A very, very simple question. When you spoke about adequate lighting in section 106, is that lighting requirement defined by the previous section that addressed lighting for cultivations for edible and marijuana-infused products? Or is it a different standard, or is it open?
It's slightly different, I guess, maybe it'll help you. Like section 106 is some general requirements for lighting. And it even talks about if there's a need to have a room dim or no lighting, you just need to provide the explanation for that. Whereas the previous section on medical marijuana products or infused products, those are specific to that production. And those requirements are higher, more stringent. You're going to need more lights, and it even gives foot candle requirements that'll be necessary.
Okay, so the adequate is a sort of an open standard.
Yeah, 106 is the basic standard, and the other one was more for the product processing.
Very well. Thank you for the explanation.
All right, we have a question, Carson City.
Hi, Ed Alexander. You talked about adequate drainage. Will the state be defining the concentrate levels that are suitable to be discharged into the drain, or will that be left up to the local governing agencies for, nutrient disbursement and things of that nature of unspent, nutrients used in the cultivation process?
And so you're speaking of like public sewers, not like a septic system, for example, right? Yeah, that's the division. Our division does not have a role with that sort of wastewater topic.
Oh, but you
need to comply, with, it'll be local requirements. There's areas of the state where there may not be local requirements, but there might be another state agency that's involved.
For the most part, in contacting several state agencies, they're kind of all shrugging their shoulders as it relates to the subject. That's, I guess, why I'm asking the question. There's going to be a fair amount of, nitrogen-based, maybe organic or inorganic material used in the growing of this product that's going to have to be discharged someplace. And presumably we'd want to identify where it's going and what concentrate level would be acceptable. So it may be something to consider.
Okay, we'll be partnering with other agencies on that. That doesn't fall in our jurisdiction.
Although it doesn't fall in our jurisdiction, I think if you start discharging open surface out onto the street, there will be an agency that will come in and say that's not legal. So you need to understand the legal requirements of all the jurisdictions and what their discharge components are, whether they give you specific guidance or not.
All right, so looking at the agenda, that kind of wraps up those sections, so,
One more quick question on the phone, please.
okay, please, go ahead.
Todd Yoren, Today's Healthcare. Section 105, 10.1, referencing the surfaces for the walls, floor, and ceiling to be a smooth surface. Most of the cultivation facilities have got to have significant support structures for carrying the light loads and so forth. Could we look at potentially modifying that to eliminate the ceilings being a smooth surface?
Section 105,
Yes, 105, 10.1.
okay. And so you would not want, you might want to repeat the question, but you want ceilings that are not cleanable, and why is that?
Correct. It's referencing floors, walls, and ceilings made of smooth, hard surfaces that are easily cleanable. In cultivation facilities, we've got to have significant support structures in place to be able to support the loads of the lights. So my proposal would be to eliminate the ceilings being of a smooth surface so that we can use support structures such as the joists and trusses and so forth.
Okay, so I guess are you speaking of using, for those joists and trusses to use bare wood and without any sort of coating?
They could be, or steel, if it's a steel structure.
Steel is cleanable. Wood
But it's not a smooth surface, though, or is that? I'm envisioning a smooth as in a sheetrock wall or a metal plate.
Well, I mean, there's different standards in these lines of work, but, sheetrock can be coated to where it's smooth and cleanable. Steel can as well, and wood can as well. So we'd prefer to leave these requirements as is so that you have a facility that's, for example, if there was no standard, then you might be using porous materials, which are going to get saturated and mold and mildew is going to grow, and you're going to have a whole new set of problems. That's what this regulation prevents. Maybe
totally understand that on the walls and on the floors makes perfect sense. Yeah. I'm referencing just simply the ceilings. Could you have, for instance, if I had put in a ceiling that had steel trusses going across it, steel beams, and I'm using those for support structures to be able to support all of my lighting system and cooling system. Would that be sufficient, or do I have to have basically a smooth ceiling and then have connections or mounts through those ceilings to support that lighting structure?
No, you don't. You would not have to have a drop ceiling to, like, in addition to your beams. You would just need to have the beams, I mean, and I'm not even going to get into specifics, but you just need to make, the beams, if they're up there, then they're going to need to be, their surface, whether it's coated or not coated, it's going to have to be, smooth and cleanable. And you don't have to have a drop ceiling because of this requirement now.
Thank you.
Okay. All right, any final questions on these sections before we turn it over to the testing requirements? Thank you.
Good morning, Bruce Gale. I want to
Sorry, Bruce,
follow up.
I didn't see you. Go ahead.
Oh, I'm sorry. Excuse me. I want to follow up with the comment that that individual just made regarding wood. So if you have a cultivation facility, it's a large warehouse type structure, and you have no drop ceiling, and you have wooden beams that support the roof structure. I don't know how you're going to clean that other than maybe using oil or something to preserve the wood, but I don't know how you're going to clean it. That might be somewhat difficult. So I just want to follow up to his comment about the wood issue.
Okay, thank you, Bruce, for that input.
Okay, this is Marla McDade-Williams, Deputy Administrator for the Division of Public and Behavioral Health. I realized I didn't do introductions when we got started, but I'll be going through the document titled Discussion Points Concerning Laboratories Marijuana Testing, dated February 24th. In opening, the points on the document identify key issues related to the testing of marijuana. Testing marijuana and letting consumers know its contents in a standardized manner is an important aspect of Nevada's medical marijuana establishments program. The provisions related to labs and testing are designed to ensure patients fully understand the products they're purchasing. Additionally, the regulations are intended to test marijuana after it's harvested and after it's altered in a production environment. This is a new industry for testing for us in Nevada. We're starting where we believe it provides the best benefit for patients. In other states where medical marijuana is allowed, establishments may or may not send their marijuana out for testing. Some establishments may even conduct their own in-house testing. The difference in Nevada is that we will require the lab results to be reported to the consumer, whether the consumer is a cardholder, caregiver, a dispensary, or a production establishment. An establishment may choose to test its marijuana in-house, but those results may not be made available to a consumer. Only the results of the independent lab may be made available. Additionally, those results may not be used to dispute the results of an independent lab. Beginning at Section 116, the laboratory and testing requirements specify the requirements for a scientific director who's ultimately responsible for the lab operations. The requirements of subsection 2 of this section should be verifiable at all times for purposes of an inspection. So for example, you started with a lab director and he left, you hired somebody else, you need to make sure that that new person's documentation is immediately available, and you need to have verified that the information they provided to you is correct. In section 118, among the requirements in this section, subsection 1 is an allowance for a lab to request additional sample material in excess of the amounts listed in the table in subsection 2. And an establishment should feel free to contact the division if it feels there is abuse of these provisions by the lab. The table in subsection 2 specifies the tests required for the product type. It also specifies the sample sizes needed to conduct the tests. In section 119, it reflects the requirements for independence between labs and the other establishments. 120, subsection 1 specifies that before packaging raw marijuana for sale, a cultivation facility shall segregate all harvested marijuana into homogenized batches and select a random sample from each batch for testing by an independent testing laboratory. The lab is responsible for collecting the samples unless the lab agrees that a cultivation facility representative may collect it. But the key to this subsection is that the lab is responsible for ensuring the sample is representative. We found that this section will need a technical change. It's not included in the document, but we'll need to include that identify that it's clear that production facilities also need to adhere to these requirements, and so we'll just make that clarification in this subsection. Subsection 2 specifies the items for which the marijuana must be tested. The testing will be guided by recommendations of the Independent Laboratory Advisory Committee. The division will staff the committee, review the recommendations, and as it accepts recommendations for testing, will specify the required tests in a policy manual that must be followed by the labs. Recommendations considered by the committee will be discussed and considered in open public meetings that will be held in accordance with Nevada's open meeting law. Subsection 3 specifies that while the marijuana is being tested, it must be segregated and may not be sold before the test results are received. There's no time limit specified for when a lab must produce results. Although not required by the regulations, labs should be clear about how long it will take them to process the required tests. And that's being clear with whoever is asking you to do the testing for them. The goal in testing is quality to ensure that patients understand what is in the products they're buying. If an establishment believes a lab is not processing tests in good faith, the establishment should contact the division. Subsection 4 requires a lab to return or dispose of any marijuana upon the completion of any testing, use, or research. A lab must work with an establishment if it intends to keep the marijuana for other use, for example, proficiency testing, or if it intends to conduct research. The end goal is always that the work of the lab helps develop better information for patients and the industry, not that it benefit the lab in its private capacity. Research is permitted under current state law, but it must be done by the University of Nevada School of Medicine. Subsection 5 guides what happens if a sample of marijuana does not pass the required tests. One exception is allowed if a product fails a test as identified in Section 127. Subsections 6 through 9 specify the allowable levels of microbials, mycotoxins, heavy metals, and pesticides. We're going to amend this section to reflect that aflatoxin B1, B2, G1, and G2 be less than 20. Also in subsection 9, the Independent Laboratory Advisory Committee will establish the allowable list of pesticides, and those pesticides then cannot exceed the amount specified in subpart C of 40 CFR Part 180. Subsection 11 requires the lab to file with the division an electronic copy of each lab test result that does not pass the required tests, and that should be done at the same time it transmits the information to the establishment. Labs must also retain those lab results. The section Section 121 allows the division to work with labs to ensure the labs are getting consistent test results. Section 122 specifies the requirements for internal lab policies. Section 123 allows for accreditation by labs, does not require accreditation, and specifies that accreditation inspections are not a substitute for inspections by the division. The division must also approve the accrediting organization before the lab may make the claim of accreditation. Section 124 lays out the requirements and establishes the Independent Laboratory Advisory Committee. 125 is applicable to inspections by the division and checks and balances to ensure that the products that were tested are the products being sold. If this option is used, the establishment must pay for the cost of testing. Finally, in Section 127, subsection 1 allows marijuana that fails a quality assurance test to be used to make a CO2 or solvent-based extract. However, the resulting extract must pass all required quality assurance tests. And then subsection 2 allows an establishment to ask the division to authorize a retest. So now we'll go to questions here in Carson City. Anybody on the phone?
Yeah, this is Adam with Mentz with Steep Hill Hayland. I just had one question in regards to in subsection 3. Subsection 4 requires a lab to return or dispose. If a lab returns, are there going to be protocols in place to make the difference in what the lab received and what it's bringing back? It just seems like there needs to be maybe some more clarification on how the return process works, or is it just something as simple as here's what we have left over, put it back into your inventory?
Thank you for the question. So the labs also have the requirement for inventory control. So if they return, they need to document that. The receiving entity needs to then document in their inventory what was returned. Are you asking about different protocols, for example, maybe for security?
Certainly not for security. I just wanted to make it clear that there was going to be some sort of chain of custody, where knowing that this is coming back to a facility from another facility.
We'll look at the chain of custody requirements, make sure that it's clear, but the labs also do have that inventory control requirement. That's where we document it.
Okay, thank you.
Thank you. Any other questions on the phone?
Yeah, hi, this is... I'm sorry, go ahead. All right, this is Matt Haskin with Canasafe Analytics. My question is, I believe maybe covered in Section 120, but I just want to confirm that there's some batch limit sizes in regards to the testing. Are we going to limit the batch sizes, or are they defined in some other manner?
Thank you, Matt. The batch sizes are limited based on the definitions identified in the very beginning of the regulations.
Okay, is that based on a pound, a weight, or is it based on just a harvestable room?
So Section 2 defines batch. It's a specific lot of marijuana grown from one or more seeds or cuttings. And then when you go to the definition in Section 12 of lot, it's 5 pounds or less for flowers, or the leaves or other plant matter from one or more marijuana plants other than full flowers in a quantity that weighs 15 pounds or less.
Okay, thank you.
Another question on the phone?
Yes, ma'am. Hi, this is Warren Markowitz from CBD Partners. I have a question regarding the quantity and distribution of the laboratories available in the state. Has the division taken into account the fact that a bottleneck seems to be appearing in terms of both production and the distribution of the product to the patient base for which it's designed to serve by requiring us to use an independent lab and to wait for testing results? Has a quantity of labs and their locations or potential locations been taken into consideration at this point in time? What's going to happen if those labs aren't up and running when the rest of the process is in place?
Thank you for your question, Warren. As we receive lab applications, we definitely will have one of our decision-making processes ensuring that there's adequate testing capacity in the state for the number of establishments, the number of cultivators and production facilities that are also certified. So that will be one of our factors in considering approval. As it relates to, I forgot the second part of your question.
Well, there appears, as I said, to be a bottleneck being created between the production and the distribution process and the patients with the lab requirement, but yet in the notes you distributed, you recognize the fact that some facilities may choose to do their own testing. If those facilities have the qualifications and individuals, such as they have a scientific director, they have the people that qualify under the statute and under the rules, would that testing be able to be used in place of an independent lab?
Okay, so when you asked the question the first time, I remembered what it was. You asked, what happens if everybody else is ready to go and the labs aren't ready to go? Well, nobody gets to move forward. It has to be tested by an independent lab. So again, you can't have in-house lab testing that meets the state's requirements. So we are striving to ensure that we have the labs up and running and ready to test, that we do our best to ensure that cultivators, if we can, that they get out ahead so that there can be product available for dispensaries once we're ready to go. But the way that the law is structured, we're bound to that 10-day application period, and we're just doing the best we can within that, a 10-day application period to accept applications and a 90-day review period for all applications to make a decision to move them forward or not move them forward. That's our burden. So within that, we're doing the best we can, but I think we have to acknowledge that at some point there may be a bottleneck, and that will just be the way that it is. We will do our best to get the labs and cultivators out first, but there are no guarantees.
I thank you very much, and I appreciate the candor. One last thing. Is there the ability for the division to actually suspend some of these requirements if these bottlenecks come to be, and we find ourselves with dispensaries and cultivation facilities and insufficient laboratory process?
there is not an ability for us to suspend that, and that's because the statutes, which supersede the regulations and give us our authority, specify that lab testing has to be independent.
Very good. Thank you very much for your time. I appreciate it.
Anybody else on the phone? Okay, I'm going to come back here to Carson City. Go ahead.
Has the state considered out-of-state independent testing facilities in the event that the bottleneck does occur, provided that they met the standards of Nevada?
So this is Ed Alexander, and we believe that you can only test if you're a Nevada licensed lab. So no, that wouldn't be acceptable. Okay, let's go down to Las Vegas. Anybody in Las Vegas?
Good morning. This is Martina Giacarino again from Black and Labello, with some questions and comments about the definition of batch and the definition of lot and how it impacts the cost on the laboratory testing. I think it's clearly in the best interest of the entire program that we maintain the utmost standards for quality assurance and treating the medication so that it's consistent. However, in researching this, it seems that the definition that we've been given in Section 2 of batch is consistent with the science, which is that the advanced science of marijuana cultivation, growers can maintain consistency of an entire room in a very simple, structured manner, and they can achieve uniformity over a substantial volume of product by using unrooted cuttings or clones and producing and subjecting those unrooted cuttings and clones, new plants, to the same environmental factors. Is there a scientific reason that we are not using a definition of lot that would permit a grower to take one sample of a room that is genetically identical and has been exposed to the same environmental factors? Vis-a-vis each plant should be the exact same potency. Is there a reason that we cannot, from a safety standard, just take one sample from that much larger quantity of marijuana, which could be hundreds of pounds as opposed to 15 pounds?
Thank you for your question. I appreciate that you opened with there's science out there that guides this. Unfortunately, for us, we need the assurance that that's exactly what is going to happen. So with regulations, we have the ability to change them if we find that our testing requirements are too onerous. But right now, we need the assurance of that consistency, and the only way that we can gain it for our own benefit is to test it in the manner that we've identified in the regulations.
I appreciate that. With the cost of the test being around $300 if they are doing all the tests that are required by the amendments, which we hope people would be doing, the difference in cost to the labs could be, or to the growers who are submitting testing samples, could be hundreds of thousands of dollars a year. Is there a possibility that the definitions could be tightened up, or there could be a time limit, understanding your point that perhaps the science needs to be tightened up and we need this tighter regulation for a year, but that this can be addressed again sooner rather than later?
Again, thank you for the question. I think one of the reasons we've established the committee, the advisory committee, is because that is the forum we will use to make recommendations going out into the future. So if we find that and it's that consistent, we have the ability to respond as soon as we need to respond in that forum.
Okay, thank you.
Anybody else in Las Vegas? Okay, And that we'll move on to the next agenda item. Thank you.
Good morning. This is Steve Gilbert. I'm the program officer for the Medical Marijuana Patient Registry. I'll be going through sections 139 and 145, which have amendments to NAC 453A. Throughout sections 139 and 145, there is quite a bit of language cleanup where we cleaned up the Department of Agriculture and the department to now read the division. So I won't go over those individually, but just be aware that they are there. In section 140, it references the materials required for an applicant for a registry identification card. In subsection 1D, omitted from there is a complete set of fingerprints of the applicant and the designated primary caregiver, if any taken by the state or local law enforcement agency. That is omitted. And added to section 140 NAC 453A 100 is subsection 2, which reads, the division will request a name-based check of an applicant, a caregiver, or the parent of a child from the Criminal Repository of Nevada Records of Criminal History. And if such check is inadequate to determine the criminal history of an applicant, caregiver, or parent of a child, the division may request a complete set of fingerprints of the applicant and the designated primary caregiver. In section 141, it's an amendment to NAC 453A 110. Here it reads, the division, in subsection 1A, the division will provide the applicant and designated primary caregiver, if any, a notice of its approval through registered mail was admitted. Currently, we're sending them out by registered mail. We will no longer be doing that. And then in section 141, subsection 2, if the division denies an application, we will send the letter of denial certified mail. In section 143, it references amendments to NAC 453A 130, and it has to do with renewals. Omitted was subsection 2, a person who wishes to renew his or her registry identification card is not required to comply with the provisions of paragraph D of subsection 1 of NAC 453A 100, and that references the fingerprints. And then in section 144, it's an amendment for NAC 453A 140, and it just outlines the new fees. Packet or application is $25 from $50, and the person's application, the division has approved the person's applications to receive such a card is now $75 for the $150 fee. And section 145, the regulation becomes effective April 1st, 2014. That's it. Any questions? Down in Las Vegas, any questions? On the phone, any questions? And Carson City, any questions?
Okay. Public comment. Anybody wants to make general public comment? So this is designed to be the last forum that we have. If it would be beneficial, we discussed last time.
The last forum that we have, if it would be beneficial, we discussed last time.
Thank you for muting your line. Oh, we have somebody down in Las Vegas. Go ahead, please.
Yes, my name is Jim Torson from Torson Industries, and my question relates to a combined operation that does cultivation and edibles in the same facility, hopefully. And first of all, the question is, can one do that, or does it have to be separate with a firewall, much like, let's say, the independent test lab is?
This is Marla. We have already ruled on that particular portion in guidance that we posted on our website as well as sent out through the listserv. If you want to follow up with Joe separately to ensure we have your email address, we'll go ahead and send that separately to you.
Okay. Well, the related question, maybe it's covered too, but if one has an integrated operation, can you share quality control, production control, and all that kind of stuff? Maybe that's in your advisory also, I don't know.
Because each establishment application needs to come in separately, it separately has to identify all of those elements, but you can identify that in the application process there's no prohibition on them being shared, but they do have to be responded to separately for each establishment application, if that makes sense.
Yeah, I understand. That's all I really wanted to know, because there's a lot of overhead that would be reduced if we could combine them. Thank you.
Okay, so we had discussed potentially having another session to possibly go over the Nevada revised statutes or anything that we didn't cover. We didn't get a lot of feedback on whether or not that would be beneficial, and I know everybody's time is valuable. So I think for now, unless we get an outcry afterwards, our next forum will be the public hearing adoption session with the State Board of Health. That's on March 14th. I believe it begins at 9 o'clock. The primary site for the Board of Health meeting is down in Las Vegas. We will video conference here to Carson City to our offices on Technology Way. The process is we will set the Board of Health will send out an agenda. That agenda will have a staff memo, which I'm in the process of preparing now. We will have another agenda item, I believe, maybe one or two other agenda items prior to getting to this issue on that agenda. But once it comes up, then I will go up to the table. I'll present the staff memo. I'll make myself available for questions to the board members. And then they will open it up for public comment on the regulations. As discussed, the board members won't be able to answer questions like we're answering questions for you today. They'll focus on the requirements of the regulations. But we will take public comment at that time, and then once that's concluded, the board members will take an action to either adopt the regulation or not adopt it. We also will present the errata, and so in the action, we will ask the board to adopt the errata that we're presenting, and that will be just the technical changes that we've discussed as we've gone through and found some areas where we need to do cleanup. So under public comment, if there are any questions about that process, we can take them and then respond separately out through the listserv. Okay, well, thank you everybody for your time, and we'll just keep moving on.
I'm sorry, Marla, can I ask one follow-up question?
Go ahead.
It's Scott Stewart, and it's relating to the detectable odor issue. And my question is where would that detectable odor be measured? For example, if you had a larger parcel with some greenhouses and had a security gate that you'd need to pass through to get into that particular area, would the detectable odor yardstick be from, say, that security gate to gain access to that overall property? Or would it perhaps be as you walked up to the door of the greenhouse itself?
Well, I think the odor provision is designed to keep down complaints from surrounding properties, and so it will be our obligation to assess whether or not those complaints are valid. So if you generally don't have someone walking inside your grounds from the public, we would likely only consider where the public has access to the property. Now, there's wind and all kinds of things, so if there's downwind and it's significant, we'll have to make decisions based on that.
Sure, great. Thank you very much.
Okay, thank you everybody. And this concludes our meeting today.
Everybody concludes our
going the wrong choice of movie. See you guys, yeah, very good. Thanks, guys. Yeah. Hi. Tisha. Peter. Well, none of the fun stuff other than I created about a medical marijuana. And the idea was to create a trade association where professionals, as we all come together, like any other trade association. And I lobby for a living, so I created myself my own lobbying club. I may be the only person, but hey, we've got 15 members, and right now we're not charging anything. See ya. Yeah. NVMMA, that's Gary's card. I'm trying to have my card printed on item paper. That's hard to find. Expensive, but fun. Oh, thank you. Oh, I saw yours. I got you got things last week. That's where I got your card. That's a really cool record. Are you from here or there or? What do you really do?
We should sit. I will definitely. Not my card.
Isn't that fascinating?
Nice to see you.
Dave Marshall. The science.
See ya.
I do petroleum, a lot of energy stuff, and quite honestly, that industry is very mature, and I've been doing it 26 years. I'm bored with it, and they still haven't fired me. I'm trying. Well, anyway, this came along, and I didn't really do anything. See you, Mr. Hiller B.
See you, Peter.
Yep.
Have fun.
Oh, yeah, anything, nothing else. Anyway, so we watched this thing go through the session. I really wasn't involved. And then, it's obviously anyway, so, I started looking at this thing. This is incredibly challenging and stimulating. And then the science thing. I think because we're a gaming state, that helps us.